JLS with everybody in love. Just put your hands up. 30 minutes past 10, and we're earlier than we're early. No, we should have started at 10:15, but we've got so much to talk about this morning. And Dr. Seshni is here with us, looking all beautiful and shiny and bright as usual. And we're live on Facebook, don't forget. So you can go live on Facebook and check us out. Dr. Seshni, good morning and welcome to the show.
Good morning, Opoku. How are you today? Yeah, you're right. There's so much to talk about. The news is, I don't know whether to feel shocked, overwhelmed. And as a psychiatrist, I'm supposed to be able to deal with my emotions and reactions. So imagine if I'm feeling the way I'm feeling. I can't imagine how you're feeling and the rest of the UK or the world in terms of what's going on.
I know. Well, Dr. Seshni, we've got so much to talk about this morning. The Omicron situation and everything. But before we proper delve into the Omicron situation, what's going on with Cyril Ramaphosa, your president?
Yes, well, I think he's...
Because the news...
Yeah, go on.
Yeah. The news says that he's being treated for COVID.
Yes.
That is called COVID.
Yes, I was going to say that. Actually, it's a bit worrying in South Africa. Yes, Cyril Ramaphosa has COVID. He's in hospital. Obviously, it's a concern. And a lot of people in South Africa, surprisingly, are getting infected. So, I mean, the fact that the president now has COVID is a huge concern because we know how well he's managed in the pandemic. You know, he's really done well. And obviously, the fact that he's now hospitalized with COVID is a concern. So hopefully, our prayers that he will get better, and that because he's led the country through the first, second, and third wave of the COVID pandemic. He's done a brilliant job. So we do hope that he recovers.
Right. We wish him all the best. And you know, thankfully, he's only got mild symptoms. So. It's no biggie, as they would say. Now, the other story is Nigeria and the travel ban. You know, Nigeria's been banned, well, not banned, but they've been put in the red list. And we were a bit concerned last week when we were talking about this situation. We're saying there was no need for Nigeria to be put in the red list because they don't have that many Omicron cases and all that. And I've been thinking why Nigeria? Anyway, we ended up thinking that it's probably because of politics. But hey, what we're going to be talking about today is the fact that Nigerians have decided to ban, to ban flying to the UK, in and out of the UK. They're going to be banning flights, UK flights. Okay. Now they're saying that Nigeria could ban flights coming in from the UK, as well as Canada, Saudi Arabia, and Argentina, according to leaked comments from the country's aviation minister. I got the leak yesterday. Actually, I was talking to somebody quite high up in Nigeria, and they said this is what's going to happen. So the proposed move would be in retaliation to flights to those countries from Nigeria being restricted over the Omicron variant of COVID-19. Nigeria was added to the UK so-called red list earlier this month. We all know that, meaning that people arriving from Nigeria had to go into quarantine in a designated hotel at their own expense. It's getting nasty now, isn't it?
It is.
If Nigeria takes this, if they ban flights from the UK and Canada and some other countries.
That's a bit of a concern. And I remember you were talking about your friend. Luckily, he was able to come back to the UK. So, yeah, it is going to be a huge concern. I mean, what's your feeling around it, Opoku? Do you think it's quite drastic measures on what I'm listening to and what I'm hearing?
Well, if I'm going to be personal with this thing.
Yeah.
My personal opinion is that why not? I mean, if you restrict me from coming to your country because of Omicron, whereas there's so many cases, many more cases in the UK than there is in Nigeria.
Yeah.
So many more cases in different parts of the world, and they're not bad. They're not put in the red list, but Nigeria is put in the red list. Then I would do the same. I would take this. I would react the same way. I would ban, flights from the UK too.
Yeah.
In retaliation to that, because it's going to break their economy. It's going to harm Nigeria for no reason. This is what I think. Well, I might be wrong. Never.
No, it will, because there's a lot of travel between UK and Nigeria, and it's a lot of business travel that does occur between these two countries. So it is going to affect both countries, and there's a lot of Nigerians in the UK. So it is, obviously, I can understand from Nigeria's point of view why they've actually taken that stance. But it is obviously a concern, I would say, and they probably need to reconsider.
Well, yeah, probably something. I have a feeling that in the political hierarchy, they're going to sit down and have a chat.
Yeah. To be honest, can I say, so one of my teachers was telling me that they've got plans to travel next year in January, and it's possible that with UK now being on high alert with Omicron, and that we've reached now 1,239 cases of Omicron, and 10 people in hospital with Omicron, no deaths according to Sajid Javed. But having said all of that, I think a lot of countries might go with what Nigeria is doing, and it's possible that a lot of holidays, a lot of plans are going to change. So it's probably not just Nigeria going to be doing this. There's going to be a lot of other countries, and this is what I'm hearing from other people.
Yeah. All right. Okay, let's go to the next story quickly before we come to the United Kingdom.
Yeah.
It's about Ghana.
Yes.
Now, Ghana is introducing some of the world's strictest COVID travel rules.
Okay.
By banning any adult who has not been vaccinated from flying in with effect from Monday. From today, there is no option to self-isolate. Okay. This is very, very strict. And Ghanaian citizens and residents abroad are exempt for up to 2 weeks, but will be required to get jabbed upon landing at the airport. So the authorities say they are concerned about a surge of infections over the festive period. Because people fly into Ghana a lot during the festive period, especially Christmas.
Yeah.
And so there is a fear that people are going to be bringing in the new variant and all that. Yeah. So far, Ghana's done really, really well in curbing the spread of COVID-19. And I think they are taking this very, very strict, rules to keep it that way.
And but I think it's rightly so, because... Go on.
What I'm thinking is, for adults who have not been jabbed to be restricted from going into the country and or get jabbed at the airport, what do you think?
Yes, well, I think that's obviously good measures that are put in place. And I think it might be surprising to some people. It might seem a bit drastic. But to be honest, if we look at the context and if we are quite objective about what's going on in terms of COVID-19, the way it's spreading and the way it spreads when people are traveling, I think that those measures are definitely warranted and they definitely indicated. So I'm quite pleased to hear that Ghana is taking such measures, and who knows, a lot of other countries will follow.
Right. Yeah, that's a good one.
What do you feel? What do you feel is more important? You from Ghana, so
yeah, I'm from Ghana. Yeah,
not so important what I think.
I would say kudos to the Ghanaian government for
definitely
taking this very firm action. Sometimes certain rules and actions might seem as if they're hurting us, but in the long run, it will go to protect the whole population. So I'll say they're doing well. The health system in Ghana especially, vis-a-vis the COVID-19 situation, I think is excellent.
I think I couldn't have said it better. I think the way you described it is accurate. And I couldn't have said it better. And as I said, a lot of other countries will actually follow what Ghana is doing. And yeah, kudos to Ghana and for managing the pandemic so well. Lots of the African countries have managed the pandemic well, including South Africa. So, kudos to them. Obviously, South Africa is in the limelight because of the Omicron variant, which is becoming a huge concern. So that's something to think about. But yeah, I think Ghana is doing really well. And it's probably going to be, like what you said, it's going to be a norm for a lot of countries to actually implement certain restrictions, guidance, and measures in terms of vaccinating people, ensuring that people have their COVID passports, they have the vaccines and then the boosters, and then also that people are obviously taking measures like wearing masks, hand sanitizing, maintaining social distancing, and isolating if they have any symptoms.
The other thing that Ghana is doing in connection with this rule is that you cannot travel from Ghana. You cannot go outside Ghana without being fully vaccinated. That's also another rule.
Okay, so
yeah,
so that's really good.
So it's working both ways. You need to get fully vaccinated before you come in.
Yeah.
And you need to get fully vaccinated before you go out.
Yeah.
So yeah. Anyway, yeah. So that's it for now. But let's now come to what's going on in the United Kingdom. Did you what have you got to say about what the Prime Minister is saying about?
Well, yeah, Prime Minister and Health Secretary, the Prime Minister Boris Johnson and Health Secretary Sajid Javid, lots of concerns regarding what's going on. And so in the Mayor of London, lots of things going on about COVID-19 and, in terms of Omicron. We know that the Omicron cases have now risen to 1,239, which is a large number. When we started off the 23rd or 24th of November with just 5 cases, and now it's gone to 1,239. And as you know, now that it's so much more, it's going to increase much more than that. So that is a concern. I think Boris Johnson is saying that we are now on high alert. So there is a concern. And I think the drive now is for the booster vaccines. So they're urging everyone, there's a rapid rollout of the booster vaccines. So anyone who hasn't had the booster vaccine is urged to have the vaccines. I've read about, and correct me if I'm wrong, about military being deployed to assist with booster vaccine rollout and over 18s. I'm not sure what your thoughts are on that.
I have not heard about the military situation yet. I've not, but I'll check that.
Yeah. So it is quite drastic measures that's going on. I'm due to I was supposed to have my booster today, but I'll probably get it tomorrow. Because I'm not at work today, so I will get my booster, and obviously just advice, but please seek advice from your healthcare professionals, from nurses. Mm-hmm. It's a disclaimer that obviously we are not saying get the vaccine, but this is a guidance from the government.
I'm getting mine next week on Tuesday, 21st, I think it is.
Good. So just before Christmas. I think most people are going to be having the boosters. I think that's like I think, to be honest, from what we're hearing about Omicron is that people that have been double vaccinated have ended up in hospitals. So I think what they're hoping that if you do have the booster, that there's a higher chance that you will not get the Omicron, or if you do get the Omicron variant infection of COVID-19, that it won't be as severe. So I think everyone is being urged to get the vaccine.
Now, what I wanted to talk about next is sort of compare this variant to other variants. So we've got loads of cases in the UK right now, but only 10 hospitalizations, and no deaths, 0 deaths from Omicron. Why do you think that is?
Well, I think, to be honest, I'm not hearing that people are dying from Omicron. So I don't think there's a huge risk in terms of people dying from Omicron. But having said that, we obviously a year and a half down since the first COVID-19 and the SARS-CoV-2 infection. We've obviously, as much as the virus has mutated and created different strains like the Omicron, the Delta variant, and the other variants in various other countries, we know that we have treatments and we have vaccines available. So that's possible that the vaccines that we have has helped, as well as having treatments and also people more knowledgeable about the virus and being able to identify the symptoms earlier, have testing done. So we've obviously have a lot more in place in terms of diagnosis, management, and not just in healthcare facilities, but people themselves, because the awareness is there that, if I have these symptoms, I need to get tested, or people are already doing lateral flow tests before they go into work. So there's a lot of input already in terms of clinical diagnoses and management. So I think that is why the NHS obviously is not overwhelmed with a lot of admissions, and also in terms of deaths.
Right. I, I would love for you to run us through the same things. But before we do that, I've just spotted this thing that you talked about, the military thing. I've just seen it on the news. It says there'll be 42 new military planning teams across every region. New mobile vaccination units, bigger sites, expanded hours for centers that are already in operation. So that's what the Prime Minister is planning to do. So yes, it is true that we're going to have military personnel, help with the, for the lack of a better word, boosting the country. Right.
So I think, so it's obviously drastic measures. I don't know what your thoughts are before we talk about the other symptoms of Omicron. Just what are your thoughts around compulsory vaccination? Because a lot of institutions, places where people work now, are saying that the vaccines are compulsory and going with the guidance of the government.
Well, when it comes to compulsory, I personally don't think that anybody should force anything on anybody. People have the right to take the jab or not. As we do on this show all the time, we throw a disclaimer, don't we? We just give the news as it is, and we don't necessarily say that you must get a jab if you don't want to. Well, people don't want to get it for certain reasons, religious, health, different reasons. So it's their own prerogative not to get it or get it. But I think that people should be encouraged rather than for it to be made compulsory. People should be encouraged, and people should be given the pluses, and it should be explained why it is better to be jabbed than not, and then let everybody make up their own minds. I mean, most people in the UK, for example, are taking the jab. So, yeah, I think that's what we should do. So I would not say that it must be forced down people's throat, as it were. Like you must get it.
Well, I agree with you. It should be something which obviously people will have the opportunity to make a decision. But on the other hand, when it comes to life and death, and in terms of what we know about COVID-19, I think people need to realize how serious it is. And I think probably it's not that people are creating fear and instilling fear. It's just that we've obviously lost a lot of lives due to COVID, and we've got new variants, and obviously our lives have changed. And we do need to protect ourselves and protect our loved ones and community. So I think in terms of thinking about, we need to think about it's not just for ourselves, it's also to help others as well. But obviously I do understand that some people, as a medic, that some people, it might be contraindicated. They might not be able to have the vaccine. And unfortunately, that is obviously a concern, and they might not want to take the vaccine. But you're right, everyone should have the right to decide whether they want to have the vaccine or not.
Yeah. Okay, so run us through the symptoms of the Omicron variant of COVID-19, please.
Yeah, the Omicron variant of COVID-19, when it first came out, the symptoms that we've heard about as it was identified around the 23rd, 24th of November in South Africa as the variant that originated from South Africa, because the scientists detected.
Sorry, let me cut you in there. Did the variant originate from South Africa, or was it sort of I don't want to use the word discovered, but was it was made clear there in South Africa, wasn't it? I don't know. What is it? Did it originate from there?
I think there's two schools of thought with that. So people say it originated from there, or it was identified as a variant.
Well, that's the word I wanted to use, identified. Because even according to the information we have, there were cases, even here in the United Kingdom,
yes,
with people who do still are cases here in the UK and different parts of the world, with patients who don't have any travel history at all. They've never been to South Africa. They don't know any South African or that. So that is the argument, really. That yes. People are saying that, and I personally would agree with them, that South Africa should not be punished for identifying the variant. That's what the world is doing right now, isn't it?
Yeah. So you're right. You're correct in that, because we do need to think about it that it wasn't actually a variant of South Africa or South African variant, but it was actually identified. So maybe I should have worded it correctly. So it was identified in South Africa. And the symptoms that we were talking about is just similar symptoms to the SARS-CoV-2 and the other variants, the Delta variants. So people usually present with a fever or temperature more than 37.7, a scratchy throat or a new persistent cough that doesn't go away, and also the loss of smell, anosmia, and loss of taste. So those are the main symptoms that we've heard about, as you've told us as well. And obviously the other other symptoms of SARS-CoV-2 with lethargy, malaise, loss of appetite, muscle aches and pains, runny nose, and other symptoms. So these obviously are the main symptoms. If the cases obviously become more severe, people will start to experience respiratory symptoms. So more coughing and productive coughing, or dry cough, and also symptoms of pneumonia. So still continue with a raised temperature or fever. And obviously at the more severe end, so the mild, moderate symptoms we've discussed, and the more severe end can lead, as the normal SARS-CoV-2 or COVID-19 strain is having respiratory symptoms where people end up in hospital, needing oxygen, needing hospitalization. But as we've not really heard whether the cases that we've had in the UK that have died, whether any of them are from the Omicron. So we still not known, but it's possible that the Omicron variant can be fatal as well. It can lead to mortality and deaths. Having said that, Opoku, I think, as I said before, because we know so much more about COVID-19, people are so much more aware. Once they're getting tested, once they're getting symptoms, they're taking care of themselves and they're isolating. So they're reducing the risk of spread. And these are the concerns with Omicron. Omicron is that it can cause a reinfection even if you've got the vaccines. It can also spread much faster. And so these are the main concerns, I would say, with the Omicron, is that it can cause like another wave of a pandemic.
Okay, before before you give us the numbers, I just want to ask this thing. I'm just throwing it out there.
Yeah.
You remember we, from the beginning when we started doing this COVID update from the 2nd of February 2020, and we didn't know much, and then we started getting to know more, and then we realized that the virus mutates, and then we got there was this huge scare about the Delta variant, and there was this one about the hybrid variants and this and that, and all them Otherwise, there's always a big scare, and then everything dies down. And then now we've got Omicron, and it's a huge scale around the world. And I believe it's going to die down anyway. Now, do we see other variants coming on or coming through?
Definitely. There's probably many more variants that haven't been detected. Because as you know, when the virus goes to each country, each a different host, a different human that it infects, it's obviously mutating. That's how clever the viruses are, because they mutate, because viruses become virulent, they become more powerful when they mutate, as you've pointed out about the hybrid, the different mutations we've had. Yes, and there was a huge concern in India with the Delta variant, and obviously now with Omicron variant. I think what we've learned about the variants is that we do need to take it seriously. I don't think it's about instilling fear and creating a hype about nothing. I think it's about us understanding that there is this virus, that we have to take precautions, and we have to get vaccinated, and we need to protect ourselves against variants and against spreading the infection. So I think because we know so much about COVID-19. So yes, there is obviously different variants. I don't think we need to be fearful about it, and I don't think obviously people it's being reported, because we do need people to know about the different variants. So I understand in the media people are talking about the Omicron variant, but if you didn't hear it in the media, then how else will you know what's going on? So I think it is important to have that understanding, but at the same time, like everyone thinks, and what you think as well, is that it's going to die down. Like we had the Delta variant, it died down. The Omicron variant, the same thing is going to happen. But
the Kent variant, we don't even hear about the Kent variant anymore.
Exactly. So, but the fact is that we do need to be cognizant. We need to be aware of what's going on. We need to keep updated and just protect ourselves. So whether it's staying indoors, staying in your own social bubbles, which I recommend, I think that we all need to just be in our own social bubbles. And I'm surprised that the government hasn't started that, again, because I think people are mixing so much, for Christmas parties. There's so much going on, and I went out on Friday night for a Christmas party, work do, and it was just a different. People were just going out in close proximity, and it's a bit different. You're thinking you're going out, but and not everyone's wearing masks, and going to places where people are dancing very close proximity, we're putting ourselves at risk. But I think we do need to think about precautions. So wearing a mask, hand sanitizing, maintaining social distancing, and self-isolating if you have any symptoms. Make sure you have the NHS app on your phone, so you can be pinged if you need to have tests, because that is still something that's happening. And get the vaccines if you need to get the first one, the second one, and then the booster vaccines. Everyone's being urged. I think most people, I would say, the government and Boris Johnson is urging everyone in December to get the booster vaccine. So I think it's going to be that majority of people, I would say, by the end of December would be vaccinated with the booster.
That's fantastic. Thank you very much, Dr. Seshni. We got 4 more minutes to go, and if you run us through the numbers, let's check out what's going on around the world. And before you do that quickly, it's probably fair to say that this thing has come to stay. So we just need to keep be aware that it's just around the corner from us, and try and keep safe.
Yeah.
All right.
I think
let's do the numbers.
Yeah, I think that's correct what you're saying. So in terms of the worldometer as of today, we've got the 13th of December. Cannot believe it's like 12. Is it 12 days for Christmas?
12, I know.
I cannot believe it.
Unbelievable.
I know.
Wow.
I know. Yeah, so looking forward to Christmas. Whether we're in the pandemic or not, we are going to celebrate, and Christmas is going to go ahead. We are determined to see the Christmas of Christmas of 2021, a healthy Christmas, and a happy and healthy, prosperous 2022. So in terms of the numbers, we have coronavirus cases, Worldometer, 270,509,038 positive cases around the world. Total number of deaths, 5,324,275. Total recovered are 243 million, 299,420. You know, when you say the numbers, it's like you have to imagine that amount of people. It's overwhelming, to be honest.
I do that a lot when I'm reading the numbers. I'm thinking, oh my God, this number of people.
It gets overwhelming. So USA is still number one, and you know they're also trying to get the booster vaccines in. So USA 50,801,455 positive cases with 817,956 deaths. India number two with 34,697,860 positive cases with 475,636. Brazil number three with 22,189,867. Number three in the world with 616,941. UK number four with 10,819,515 with positive cases with 146,439. So UK is still very high, I would say.
Yeah.
We are becoming a country of concern, and I don't want to predict anything, but we are a country of concern at the moment.
Yeah.
And it's surprising. I'm not sure why we are still that at red alert. So Russia number five with 10,046,454 positive cases with 290,604. So Russia has almost the same numbers, but more number of deaths in terms of in comparison with the UK.
The UK,
Yeah. So South Africa, we've got 3 million, number 18 in the world. With
South Africa's way down at number 18.
Yeah, way down, and 3,167,497 positive cases with 90,137 deaths. And then we've got Ghana, also quite low down. I always have to scroll for it.
Scroll all the way down, 100 and something.
Yeah.
Where is Ghana?
I've got it. So 107 in the world with 131,547 positive cases with 1,243 deaths. And we just
Should we check Nigeria? Should we check what
Nigeria is? Nigeria was also quite low down.
Yes, Nigeria, 93.
Okay. So Nigeria, you've got it quicker. So Nigeria, 93 in the world, 217,481 with 2,981. And in terms of the 24-hour figures, we have UK figures, so let's go through those figures, which is really important. So 48,854 new cases and 52 new deaths. So the cases are actually rising quite a bit.
It is.
The day before was 53,812 with 132 new deaths. And December 10th was 57,335 new cases with 120 new deaths. And according to Sajeev Javed, he's not saying whether any of these deaths are due to the Omicron variant. So it will be interesting to know what actually the cause of death in terms of, they're saying it's COVID-19, obviously. But I think it will be interesting to know how much. Obviously, the government has all the information, and we will only know what they know and what they disclose to us. But it will be interesting to see. It'll be interesting to see if we do go into lockdown maybe after Christmas. I don't think it will happen before Christmas. I think it will happen in the new year.
Me too.
I think we probably, but maybe not a full lockdown. It will just be again, just basically encouraging, as a government is encouraging people to work from home. So I think it will be more along the lines. I don't think the economy would manage for us to go into full lockdown. It will just be, again, very strict measures and bubbles.
Once again, thank you very much, Dr. Seshni, for coming to joining us on the show and bringing us an in-depth. Well, we've had an in-depth discussion of what's going on with the Omicron situation, COVID-19.
Thank you so much, Opoku, and have a fantastic, fantastic day and lots of love to everyone.
Day too.
Stay safe, and I'll see you next week.
See you next week. Okay. Bye for now. And
Bye.
that was Dr. Seshni, a consultant psychiatrist.